All right, well, I want to go through a little bit of how we use the Aerolase devices in our practice, and then we're going to do a little demo today. How many of you have Aerolase? Great. How many have good success with Aerolase? Great. And I agree, it's one of those few devices that can do so many different things and has lots of possibilities because the energy is super strong, but actually it goes deep into the skin and doesn't affect the outer surface, so you can treat your darker skin types, those with sensitive skin who have mixed ethnicities, rosacea, acne, those that are nervous about treatments, because this can do a lot of things. Because what I tell people is, to me, I'm always concerned about tight and bright. I want the skin to be, people worry about aging, right? So they're worried about their skin becoming looser and sagging, but also pigmentation, acne, uneven tone, pores, wrinkles. I mean, the list goes on. Literally, they come in one everything. So we got to make the skin tighter and brighter. How do you do that? You got to use a combination of lasers, peels, skincare, etc. This laser is my go-to deep heating. It's a treatment that's going to remove hair bumps in ingrown hairs. It's going to remove redness. It's going to improve pigmentation. It's going to help acne. My Accutane patients all get this. Here's an example of a patient doing this treatment with laser and peel. Doing a consistent amount of it can improve scarring, improve redness, and overall pigmentation. So in your practice, to me, it's the staple laser. It's what everybody should have. And the benefit to it is being able to treat the 4s, 5s, and 6s, mainly even more the 5s and 6s, let's say, because the 4s are somewhere on that border. You can almost treat some of them in certain ways if you pre-treat their skin. But 5s and 6s, for sure, you got to be careful. I mean, I can ask my staff how many times a day I see patients that come in with white streaks on their face from an IPL being done on a type 5 or 6. It's unbelievable. Thank God we have stem cell therapies now, and I can literally reverse them. But it's almost unheard of 5 to 10 years ago of us being able to do anything for those patients. So we know with aging, like I said, they want everything. Collagen improvement, textural improvement, pigmentation improvement. And as we age, all those things start to appear. Your younger patients, their pore size is too big. They got some dark circles. They care about their acne and their redness. But as you get older, hormones start to kick in, or you lose them a little bit, and there's all these fluctuations in weight. You start to sag. You get pigmentation. Acne pops up again as an adult female. It's like, what's going on here with my life? And these sunspots and everything. And then you get patients like this who all of a sudden, out of nowhere, just acne pops up. So what we did was had to do a combination therapy. This is my Accutane protocol. This is putting patients on Accutane and doing Aerolase every week for the first month or two, doing it every 2 weeks thereafter, and every month once it's under control. And you're doing the Aerolase plus the Accutane plus some facials, and look at this improvement. I mean, she should be smiling even more in the other picture, but it's improved. And you treated not only the redness, but what did you guys notice here? This is the one thing I want to talk about. What is the biggest thing that you noticed? She doesn't have scars. See, this is the thing. When I was a resident, I was told, you can't do peels when you're on Accutane. You can't do lasers. And I did it anyways because I found that it didn't make a difference. But what I found was those patients don't get scars if you do the treatments correct, because their epidermis is so much thinner. It's smaller. It's not thinner. It's actually shorter, and allows more collagen production when it's small. When it's shorter, it's like degreasing or de-epithelializing the skin before you laser it. You get a better result. So those patients like this that are doing constant peels, constant lasers that stimulate collagen while they have inflammation don't get scars. And you can see we can treat that so much earlier. You're going to make this patient wait a year before they get a scar treatment? It's crazy that we can treat with the Aerolase while they have acne. And improve not only the acne and the scarring. And yes, it's skin rejuvenation is complex. We may not be able to do that exact treatment in someone with a darker skin tone because we might do a different laser, or we may do microneedling radiofrequency instead of doing a laser treatment, but you can still do Aerolase. That's the best part. Because not everybody here, this is like my practice, actually. This is like my practice. I have like every single one of these lasers. I was trying to like check off. I was like, oh my God, this is crazy. But you don't need to have all of those lasers if you have devices like this that do a lot of things. Now, I'm not saying that every person here isn't going to be the skin guru and want to do everything possible. If you want to, I think that's great. You should aspire to have all these lasers if you want. But if you don't have all those things and you're just doing you have a spa, or you maybe do some facials and a little bit of lasers. This is a core laser to be able to do hair removal, rosacea improvement, acne, fine wrinkles, especially if you have the era for erbium resurfacing, as well as just overall rejuvenation. This is your facial booster. You do a facial, you add this in. The patients love how their skin looks. They glow immediately. So you're reducing oil, and you're doing all these things because otherwise you need every single one of these lasers. Each laser, that's why my patients, they come in, they go, I'm getting 5 lasers. Like they always say, I go, look, I'm treating a lot of things here. I have to treat your redness, I have to treat your texture, I have to tighten your skin, then I have to do long-term pigmentation issues. So I'm combining all these things, but this laser allows you to combine a lot of them at once. Now that's by using different focused lenses, for example. And yes, the lasers will be costly, time-consuming, and not fully complete. We're laughing about it because my consultants know I get really upset when a patient comes in and doesn't know what they're going to do, because I have them, they are talking to them consistently to make sure they know what they're going to do before they come in, because I don't have the time. That's what I'm saying. But then somehow they have to see me for a minute or two right before they get numb. I have to see Dr. Emer before I get numb. So I go in and I walk out and, okay, add in the Aerolase, add in this, add in that, because they end up wanting to do so much more, but they're always adding this in because they see that improvement right away. They love the tightness that they get from it, the pigmentation. We've had many patients who have gotten irritation and burns from peels that we've reversed with this laser. That we've gotten you have a client that just burned herself with a weird Cosmelan from the internet, which I do not suggest doing just because you think it's cheaper. She burned herself all on the side, got severe hyperpigmentation all along the sides of her body, and Aerolase and mesotherapy cleared it up, right? So you can do a lot of things with this and make it more costly for patients. Now, obviously, I'm like this artist with the 20 things on my palette, so maybe it's a little more expensive when I get involved, but you can do a little bit with just one device. And the best part is you could treat the patients of skin and color. I'll tell you, I have a lot of patients that come and say, I didn't know I could do anything. People have always told me, don't go to a dermatologist, they're going to burn your skin. Especially a white Jewish gay guy from the Midwest. That's the best. In New York and the East Coast to West Coast, they're like, what does this white guy know about dark skin? That's what they always say to me. I go, look, I did my residency and fellowship in New York. 70% of my patients were Black, Hispanic, mixed, or Latin, or mixed ethnicity. I was like, I know how to treat dark skin. They're like, you're really white. I don't know. So, but then we show these videos, and they're like, wow, he actually does know. My best friend's Jamaican in LA, so I made him do a peel and did Aerolase treatments for his under eye, and he showed the results. And now all these Jamaican patients come into me because they're like, we saw that Jamaican guy on there, and it always leads into the people trusting you a lot more when you can do these sensitive issues, treat these sensitive issues. And the risk for those patients are burns, stigma just from going to people because they know even touching their skin they get pigmentation, etc. Now, the other thing is that obviously the modern patient wants literally no downtime, everything for free or minimal cost, and a result they see immediately. The best part with these types of deep dermal heating treatments is you actually see the results quickly. When I first started doing lasers with microneedling, now everyone's like, oh, lasers with microneedling, everyone does that now. Well, 6-7 years ago they didn't, and I was booed off the stage at the AAD when I talked about doing it. But the fact is, the reason I did that was lasers take time to see the results because they induce remodeling. You damage tissue, the tissue has to heal. Then you add microneedling, trauma, those microchannels heal very fast. So the people's skin looks better right away. So when you lasered and microneedled, people actually looked better quickly. And then they would want to come back and do the treatments. So I combined this with a microneedle, and the results were so much better. We would see them all the time. They'd want to come in every week or two, whereas when I lasered them, they would come in less often because they didn't see the results so fast. Here you can see it much more quickly with literally no downtime. My patients are like, I have a medical emergency, I have a little acne, and I have to be at my sister's wedding in 2 days. We need to Aerolase, steam, light, let's do it. 2 days, a couple treatments, and 2 days later, they're great. They're so happy because the Aerolase literally reversed that inflammation. So we need stuff that's simple, comprehensive, because you guys most people are not going to be able to do this, and most people don't want to do this. My staff goes crazy already with the number of lasers I have them pulling it out of rooms. But the best part is the chromophores that are being attracted here don't even matter so much because of the microsecond technology. That technology allows you to bypass the main components that cause issues, like the melanin in the skin specifically, or the skin itself, which normally would absorb laser and cause a resurfacing. But in this case, we want the energy to go deeper into the follicles or into around in the deeper dermis so that we get that heating that stimulates all these other things below to improve.
Hi, I'm Jillian. I'm 28 years old and I suffered from severe cystic acne. I went on Accutane and Dr. Emer put me on a treatment regimen and different skincare products. Dr. Emer suggested that I do a treatment called Aerolase. It reduces the inflammation and gets the red out of the pimple and made the irritation go down and made it a lot less puffy. Since my acne has cleared up, I feel so much more confident. I can go to the gym with no makeup. I can go out and feel like my best self.
Hi everyone, it's Danielle with Dr. Emer's office. We have our patient here doing a few treatments and we're starting off with Aerolase. This has become one of my favorite treatments because it is very comfortable for the patient and it treats a variety of conditions. Because this is a 1064 micro pulse laser, it delivers a very fast amount of heat and energy to the skin and the skin releases that heat very quickly. You just float all over the skin. This is great for all skin.
Because of my redness, it's really been nice that it helps calm that down from my rosacea.
With that said, though, like I said, this combination of focused energy allowing us to treat numerous things will allow you to have less modalities. And the wavelength that this is specific for, the YAG, is extremely specific. It's that for deep dermal heating, which is going to allow us to treat a lot of these different conditions. The other thing, too, is the pulse duration. Making it so fast will allow heat to be very focused and allow it a high energy to go to the deeper layers without damaging the surface. Because if it was a little bit slower, it would burn the surface because the energy is so strong. And you can see here the level of the hair follicle and showing you what we're treating here. Everything below allows things to rise up. You can calm them down by doing avoiding also a lot of pain.
Hi everyone, good afternoon. So that was just a great talk, and I especially love the acne, and I think this is really important, what you're saying about the Accutane, because you are really ahead of the time, and studies now have shown that you can do Accutane and procedures. So you were doing it, and the science has followed, and I think those are great. So, we talk about the increase in the skin of color population, and 1 in 4 skin of color patients want aesthetic treatments. But the thing is who is a skin of color patient? So how do you know you have a skin of color patient? So I live in a very, predominantly white Caucasian area of Palm Springs. But there's skin of color patients all around us and in our practices. And what you want to know that person is a skin of color patient and not wait until you do the procedure to find out. So we know that pigmentation is the #1 problem globally. Wherever you go around the world, pigmentation is #1. And it's hyperpigmentation, acne, melasma, PIH, hair removal, and pseudofolliculitis barbae, which is a very big one. And I want to highlight pseudofolliculitis barbae in women. We mostly think about it in men, but it occurs a lot in women. So that is really a passion of mine. And I'm just calling in all women of color to come in because the Aerolase is doing wonderful things. So we all know her. Actually, we've got a little bit of American Idol theme. Paula Abdul was here yesterday. And here is, here's Carrie Underwood. And this is what I say, beware of the Oklahoma blonde, because she has blonde hair and blue eyes. However, is her skin going to act the way she looks? No, because she is part Native American. and you want to know it before you do it. Multi-ethnic children are everywhere. Here I am with my son. And although phenotypically he may look one way, grow up, get a chemical peel going, and it's going to be different. Native American with the child. So this is a whole new area. It's so exciting. There are emerging skin types happening right in front of our eyes. And access to care is so important. So why I'm really passionate about this technology is because now the doors have opened with skin of color patients and they have access where before a lot of people were turned away, no, we don't want to do, and it actually wasn't a bad thing because better to do no harm than to do a laser treatment and have a complication. But now we have the technology in this 650 microsecond technology to feel safe. So the properties which get us into trouble with skin of color are really two areas. Superficially is the melanin in the epidermis, which heretofore has been a real problem. The gold standard, the 1064, long pulse neodymium YAG laser was kind of the gold standard before this. But there were problems with that because it was very technique dependent. And that's why people who didn't really feel comfortable kind of a little bit scared about using this, where now we have a technology which is really kind of operator proof. We'll get into that. But the superficial part, the epidermis, and then last, the exaggerated responses of the fibroblasts, right? Which make an increased risk of scarring. So these are the properties we have to address. So how many people have heard of this SkinType classification system? Okay. Oh, great. You're getting better. It's getting out there. So anyway, I published this in 2008. And it's an article in the JDD. And basically, it's a way that we, as practitioners, can classify our patients. Because heretofore, this SkinType classification system, the Roberts SkinType classification system, the classification systems were always based on ethnicity, gender, where you live, what color your skin is. And really, when you get right down to it, none of that matters. What matters is how your skin is going to respond to insult, injury, and inflammation, right? Inflammation as in PIH. I don't care where you come from, what sex you are, your age, it really is irrelevant. So there are 4 elements of the Roberts SkinType classification system. I did not want to reinvent the wheel. The Fitzpatrick system is a very good system. And most importantly, we all know it. We all know what a Fitzpatrick 1 through 6 is. However, historically, these were burning types. So this was all based on photobiology. And that's not the whole picture. It's part of the picture, whether you burn or whether you tan. It's important. However, you can go awry if you just, use the Fitzpatrick. So I introduced a hyperpigmentation scale, which, you can see. Oh, there we go. You can see, and it goes from, I just want to point out, it goes from hypopigmentation, which is H0, to severe and permanent. So we don't think of, and Jason, I'm glad you talked about the hypopigmentation on the cheek. We don't often think of hypopigmentation as a complication, but it often is, and it really traditionally has been much harder to treat. We always say we rather have the hyperpigmentation, can get away the pigment, but when you have that hypopigmentation, it's devastating for a skin of color patient. So you want to avoid that. And how do you know if a patient, I'm going to ask this to everybody, how do you know if a patient hyperpigments or not? Anybody? Got to look, right? You got to ask them and just look. Get them undressed and look for signs of hyperpigmentation. Oh yeah, that curling iron burn. Yeah, I got that 3 years ago. Well, guess what? That might be moderate and transient hyperpigmentation, moderate and permanent hyperpigmentation because it lasts for over a year. And the same goes with the scarring. You've got to get people undressed and look and see, do they have scars? And once you do this, you can come up with a code. And again, I talk about these emerging skin types from mixed ethnicity. These people have really unpredictable outcomes. We have no point of reference on how to treat them, a lot of trial and error. And although we have safe devices like the Aerolase, there are still devices out there that are very operator dependent. So once you classify this person, you basically have a skin type code which is unique to them, and they can take wherever they go. You can travel with it, you can communicate with it. When you're referring a patient, you can send them with their skin type classification, and it goes like this. A person might have the following skin type: a Fitzpatrick 4, hyperpigmentation 2, glow gal 1, right? We don't need to reinvent the wheel with the glow gal. Photo aging, it's already been done, and Dick Glogau did a wonderful job with that. So we have the Glogau in there. And then scarring 3. So what it translates to is this patient has light brown skin, burns minimally, tans well, with minimal and permanent hyperpigmentation, right? Age 2. There's no wrinkles with early photo aging, the Glogau 1, and they have hypertrophic and or raised scars, S3. And that's basically code. Now, millisecond versus microsecond. A microsecond is 1/1,000th, and a millisecond is 1/1000th of a millisecond. So that's very important, and we'll kind of get to that later, but we talk about microsecond technology, and I just want everyone to know, kind of what that is. And the modalities, the limitations, and the pluses heretofore before this laser, when you use topicals, right? Topicals never affected deep pigmentation, and oftentimes our topical, our hydroquinones had a rebound effect. So it wasn't really a plan. We make a plan for a patient, it can be part of it, but it was never really gonna get you all the way there permanently. And that's the thing with topicals. You could get there, but you couldn't get there permanently because you couldn't use the product permanently. And all the non-hydroquinone agents, we all know, they're good, but you're not gonna get a home run with them, right? So peels, very user dependent. From the way you put it together to how you apply it, it's just all over the board. You have great peelers, you have not so great peeling. So again, not a predictable outcome. Then we talked about the 1064, the long pulse. That was in the millisecond pulse and width domain. Again, gold standard, but lots of issues with hyperpigmentation, hypopigmentation, and scarring, which is user dependent. And then RF is great, but again, a little bit of a different animal, can be painful. And don't forget, I have treated patients with PIH from radio frequency. So again, user dependent. Microneedling, great, but again, you're limited to how deep are you gonna go. So there was really a need for a device that could be like a workhorse for skin of color patients. And if you're just starting your practice, you're trying to build a skin of color patient, maybe to distinguish yourself from others in the community, this is a very safe. So for me, there was a lecture that I was listening to that talked about, KOLs and KOLs being paid, and it was a little bit negative. Well, once I learned about this technology, I'm like running down the company to speak for them because I so believe in the technology, and we so have to get skin of color patients into the aesthetic pipeline. I think that, this does it. So we physicians, we're continuing to search for to-go-to device so we can treat. skin of color. Our challenges are, you want to feel as confident with a laser as you do with a can of liquid nitrogen in a white skin patient. Something you can just pick up and use it, and you're going to have a repeatable outcome. You don't want to create a complication. Oh, if you're just getting started, you don't want to have a lot of devices. How nice for it to have one device to treat a multitude of conditions. And I want something with proven results. And then again, like I said, I'm fresh out of residency. I don't have a lot of money, but I want to build a diverse practice, or I live in an urban area with diverse populations, and I want to build a skin of color patients and have success. Jason went into this, but basically we're delivering a deep, short pulse, which is below the burning threshold, which is 800. So at 650, you're well below the burning threshold, so you're going to always stay out of trouble. And the pulse is powerful. It hits the target, and is gone. And you're able to get to deeper structures. Very important in conditions like melasma, right? We all know now that there, in addition to the epidermal component and the dermal component of melasma, what do we have? We have a vascular component. We've got solar elastosis. So how are you going to correct and get great outcomes in melasma when you're not addressing all those? So with the Neo, you're able to address all of this, and it does a great, great job. This is an article, I believe is in the folder, the April JDD, which a group of experts in skin of color presented their work, their cases. We had a discussion and came out with really good practical information that you can use for your practices. So it's very practical and it's a great supplement. Okay, so here is an African American, and I just did simple skin rejuvenation in her. She just felt she was looking tired, early 40s, feeling more like early 60s. She also had PFB and just needed something. Never had anything done before, so really a newbie to all, aesthetics. And she wanted to have a nice, safe procedure. So this is her. This is just after 2 sessions of the Neo, and I just did a, all over her face, just a global rejuvenation, and she just looks better. She looks younger, her skin looks fresher, tighter. Notice her pigmentation, the lentigines on her cheeks, lighter. Just a lot of, look at her forehead, so the results really speak, right? A picture speaks for itself. This is just a great skin rejuvenation. And especially, I'm gonna just say here, African American patients don't necessarily know that they need skin rejuvenation, because there's that myth out there that, you don't age. So this is what we're all here for. Please talk to your, skin of color patients about skin rejuvenation. Yes, you can look better. Your skin can be tighter. Your skin can be devoid of pigment, because we do age. We just age in a very different way. So, sometimes you have to have that conversation and not wait for, and this is practice building tip, don't wait for the patients to come to you. When you're doing other things, or you're growing their hair or whatever, removing their skin cancer, have these conversations about, what are you doing for your skin? There's a really easy procedure that we can do to get you to look great. So this is Michelle Henry's patient, and this is after 3 treatments with the Neo, and marked improvement in her acne. And to what Jason was talking about, I think this is an exciting realm. We're seeing a lot of good results in deeper acne, nodulocystic acne. So we're beginning to use the Aerolase Neo a lot for these patients. And remember, the primary lesions of acne in a skin of color patient is not only your acne lesion, but it's the PIH, the melanotic macule. So until you clear that, your patient's never gonna be happy, because they're gonna still think that they have acne as long as they have that brown spot. So you've gotta get rid of that too. I said another patient, this is, yeah, Dr. Awudu. Again, this really bad looking, acne. Does have a pointer here? No, but you guys can see it on the jawline, going down to the neck. She's another PFB possibility, right? Probably shaves. Most of the, Latino African American women who have PFB are shaving, plucking, causing more, PIH. But this again is a second treatment, beautiful result in her. And then if you can kind of look up to the tear trough area, does everybody see the little improvement in that tear trough? First sign of aging in most skin of color women is the development of a tear trough. That's another thing you should go after. You have to bring it up to your women that they're having the tear trough because of mid-facial descent. And I love this laser on the tear trough area. It does a really good job. And in combination, this is that patient that's been treated for 10 years for melasma, and you can't get rid of it. It's just brittle melasma. You've gotten no result. So this was her with the 650 after one treatment. And this is not a home run result, but in someone who's had no progress with their melasma, for them to be able to get hope that this is going to clear up. And she went on to get clear. So in combination, I do a lot of combination with the Neo, and this is an acne, bless you, this is an acne patient with microdermabrasion and the Neo. I did that. I did a peel on top of it, and then she just had this really dry skin. So I did a little topical carboxy therapy, the CO2 lift, to kind of get her hydrated up. And here she is after 3 sessions. And this is, again, a work in progress. We'll have to continue. This case I'm really proud of. Anyone familiar? You familiar with maturational hyperpigmentation? Anyone? Well, it's not very common, but it occurs in African American, particularly men, where there's like a hood of hyperpigmentation that starts on the head and comes, and it's so even that you're like, why are you here? And this patient said, I'm here because I'm like 6 shades darker than I was, 6 years ago. And what can you do about it? And can you help? Well, I didn't know really what I could do, but I said, well, let me try. And I started doing, I really like microdermabrasion and the Neo in combination. So I would say probably 75% of my patients, before I do a Neo, they get a microdermabrasion. I just think it works better. So I do a microdermabrasion. I go ahead and do the Neo. I did some short contact cysteamine. This is all in the same session. And before the cysteamine came out on the market, I was doing like vitalized peels. Well, it took 2 years, but we finally got them clear. And I will continue to do the Aerolase Neo treatment on him. I'll do one once a month and pulse his topicals because, we worked so hard on this, you don't want it to come back. I don't know anything else that can treat PIH. So this is like this can, traumatic PIH. So this was acne scars and PIH. I think this might be a Dr. Henry patient. Again, the Neo and a chemical peel. Excellent outcomes for this case. Things that we weren't able to do before. And not only that we weren't able to do before, but that we were scared to do, right? Because the last thing you want to do is make this worse. But now we have something that can make it better. And this case is Dr. Burgess. And she's doing, she submitted this case, and she's doing, collecting these cases. And this is a Fitzpatrick 6. And guess what was done on this patient to cause these burns? IPL, okay? So I'm gonna, I'm very even, I know. So I'm gonna channel Dr. Elliott Battle here and say, never, ever do IPL on an African American patient. Do not do it. Okay, there's no good coming from that, right? So these burns were treated with hydroquinone, and then she went ahead and used her Neo, did 2 passes, spot size 6 millimeters, and look at the results. Really great results for this. I mean, this is someone you can make a difference in. So I think this is another area that, you know, we talk about, you know, the Neo, using it for, I just want to go over what we're using for acne, hair removal, PFB, you know, pseudofolliculitis Barbie, acne keloidalis nuki, melasma, PIH alone and secondary to acne, and now we have rosacea, redness of all types, and now we have another indication, post-inflammatory hyperpigmentation secondary to trauma.
We have our skin of color patient, and this is great. Actually, you come up close. I don't know if you guys can see, but we'll put this on social. I'm going to touch her skin a little bit. Turn to the left a little bit. So she has just some irregular complexion issues. Not so much PIH, maybe in a couple spots, but you can see like around the mouth area here, around her forehead, it could be somewhat sun exposure, maybe even little ingrown hairs or acne. Here, I find frequently my skin of color patients around the mouth, neck lines, groin, armpit, those types of areas where you rub, like her neck, for example, will start to get some pigmentation in those issues, sun exposure and trauma, etc. So what we're going to do is we're just going to start now. I like to go somewhere in that 4 to 8 range of passes, depending on how her skin reacts. Initially, when I first started doing this a little more aggressive, I was worried when I would put a lot of heat into the skin. I was thinking of a rebound, hyperpigmentation, things like that. I haven't seen that yet at all, actually. And I have a lot of patients where I'm removing a lot of NFL players' full beards because they get so much pseudofolliculitis in their beards, they'd rather just have no hair. So we literally have removed people's full beards, face and neck on these athletes, dark skin. I mean, super dark, and they look great, and they're totally fine. So we're gonna start, now you can put your head straight. I want you guys to come super close. Okay, close, close, close. As otherwise you're not gonna get the experience. Now here's the thing. If she has any vellus hairs or any terminal hairs that are here, you may see a little bit of like a little smoke come up because the hair would have been attracted as well. Obviously you don't wanna treat this over a male beard unless he wants the hair to be removed. So we just literally go back and forth. Now, how does it feel? What do you feel like?
It just feels warm.
Just feels warm, like warm water, or little shocks? Little baby shocks. Painful or no?
No.
So good, because at this level of 4, it shouldn't really be so bad. And you're just kind of following along. I want to be careful of her hairline. So social, everyone on social, I just want to introduce you guys. We're here at the Aesthetic Show 2019, the Wynn Hotel, with myself and Dr. Wendy Roberts, a guru in skin of color from Palm Springs, beautiful and smart, everything you want in a dermatologist. And I'm here today doing a demo with the device called Aerolase, or the Light Pod Neo, that has a 1064 nanometer wavelength with a super fast pulse, so we can actually treat skin of color, their complexion, acne, hair. For her, it's just even tone. So turn a little bit to your left, turn it to your left, perfect, little less. And we're gonna keep doing that treatment so that everyone on social can see. You guys are totally fine as long as you're not directly pointing this laser at you, you're totally safe. And does the audience have questions as I'm doing treatment?
Yes, I'll repeat them.
So someone's gonna have to repeat it to me?
I'll repeat them.
Okay.
Go ahead. No, she does not have numbing cream. You don't numb for this.
No, so that's the other thing. She doesn't need numbing cream. And to be honest, I find it sometimes can interfere with the treatment itself, especially if they have rosacea, because it could change the overall appearance of the vascularity. But she shouldn't really feel much pain.
And I agree. And you also want feedback. So if your patient is numb, they can't respond, you know, and tell you where the hot spots are. So you save a lot of time when you don't have to prep the skin. Jason, the question is, can you burn someone with this?
I mean, I haven't been able to see that possible, but I think if you kept overlapping pulses in areas that have a lot of pigmentation or hair, you could potentially build up enough heat to cause either a blister or the hair follicle to burn kind of and cause some skin burn, but you really shouldn't do that. I mean, it should be light enough that you're not going to do that. Again, the energy is below that 800 microsecond threshold where we're not burning thermally. We're not putting a lot of thermal heat into the epidermis. Turn all the way left now. Left. There you go. So we're going to show the sides here. Now, I always ask the women, because if they have a little hair here, do you care if any of this hair gets removed? You can get rid of it. I've never had a woman say no. I have never had a woman say no.
I was gonna say,
ever.
Tell me you've had it.
But I always ask because I'm like, do you care if you have your sideburns anymore or no?
Bye bye, baby.
Bye sideburns. So let's get rid of those.
Sun precautions after treatment.
Well, remember you guys, most sun sensitivity, obviously in our darker skin patient or mixed ethnicities, they always have to be cognizant of sun. But most sun issues are related to resurfacing, not as much deep heating. So you see there's nothing happening to the surface. So it's really not, I mean, I wouldn't restrict someone from going on a vacation just because they had an Aerolase treatment, but I still would tell them we need to do your skin care, your sun protection, helio care, you know, for sun protection, but I would be okay with her going and doing whatever she wants as long as she follows our aftercare protocol.
Yeah, I agree, you know.
And you're in Palm Springs where it's always warm and sunny, so let me know.
We have helio care in the water in the office. Okay, but but you know, the melanocytes are labile. So even though, you know, you're not supposed to hit them, I do, you know, I'm conservative and I do want them to be protected in the sun. So they go home with a goodie bag with sunblock. And I'll say, you know, for 48 hours till everything kind of calms down, don't go out in the backyard in sun. Don't go to the tennis game with no sunblock.
Yeah, I wouldn't tell someone to sit by the pool, but if they wore a big hat and they wanted to still go on a hike or something,
yeah, exactly,
I'm okay with it.
Sensible activities.
Yeah, good sun protection, both a physical and chemical blocker maybe, that type of thing, and go from there. I have them on all of their topicals. I don't stop their topicals for any of these treatments. So if they're on hydroquinone, retinol, kojic acid, any of those treatments, I just continue it.
Yes, I as well. You don't have to stop. Okay, Jason, another question. In the non-skin of color patient for sideburn peach fuzz, does it work?
Yeah, you know, the interesting thing, I thought it wouldn't work because it's not dark. But interestingly, you do get a reduction over time, especially in my patients that are very consistent. So I have them dermaplane, and we do that in Vanica. And I find that they get a very good result. Did you guys ever use Vanica?
Yes, I love Vanica.
You know, I think it's great for these little areas like...
Oh, it's great.
She has down here. I think it'd be great for her to use.
Vanica is, it's eflorethine.
Yeah.
It's eflorethine. It's a topical, came out decades ago, but it's still kind of hanging around. And exactly, with... and I have a very similar protocol, microblading, the Neo, and Vanica.
And you're doing your microdermabrasions, and that's going to help, you know,
dermaplaning, not microblading.
Keep the skin cleaner, so then the energy that's being delivered will go into the hair follicle. Obviously, if the hair follicles aren't too dark, it may not give as much of an outcome, but I do find it reduces it.
It does.
The women love their upper lip, so I say, do you want any of your upper lip hair?
Pulses.
Do you want any lip hair?
Oh, yeah.
You want to keep it?
No.
Oh, no. She's like, hell no.
Great question.
She's like laughing. No, I mean, I've never had anyone say if I have lip hair that I want to keep it. So you know a little bit of that duskiness, like you showed that great photo of the patient that has just kind of the dusky appearance in their their face is just darker as the
Yes.
time has gone on. You know, that's some combination of epidermal and dermal pigmentation that
is.
requires these chronic exfoliation treatments plus the deep heating. And I find it's just a combination of things, and especially in our darker skin patients or patients with mixed ethnicities that already have a little more oily skin naturally and have good collagen production, I think you're just going to make them look even better as they age, because they typically look better anyways, and now you're going to get more collagen production.
Exactly, yeah, I agree. So there's a question about stacking pulses in the acne patient. Did I get that right?
So here's what I always tell people to do. What was the actual question? Is there any or no?
Is there an endpoint for stacking pulses in the acne patient?
Yes, so with this lens, you kind of want to diffusely heat the skin, and then you would want to switch to the smaller focal lens, turn towards me all the way, and then only pulse over the acne itself. And that was that lens that I showed you on the rosacea video, where it had the little spacer, and it was a lot smaller. I think it's 2 millimeters.
Yeah,
Maybe it's 3, but I think it's 2.
2.
And and then you just do that right over the cysts, keloids, inflamed comedones, clogged pores, etc. And should be fine. How does it feel here?
Yeah, I like that technique
You're
as
okay.
well.
I'm gonna go up one
global,
just to test.
and then I'm
doing it right now. I'm going there. Don't you worry.
But I don't stack right then. I'll come back around.
Yeah. I only heard that come back to the area, so I'm assuming you're saying that you wouldn't stack right after you've done the one treatment.
I'm not going to do like 3 stack pulses, but I will hit it 3 times by coming
if
back.
you give a little bit of a break, the person's they cools off, and the risk is minimal. The inflammation goes down.
Any other
And so
questions?
she has some straggler hairs along her jawline here. This is very hormonal.
Yeah, go get them.
And you could see a little shock that kind of occurs. When I first started doing this, I'm like, oh my God, like there's like a fire starting here on the skin. But what that goes to show is how strong the energy is in that follicle, because you can look in really up close and see little, now you don't want too much of that because you don't want the surface to get hot. Are you okay? I'm gonna go down one. But
Don't you think, Jason, once you start looking for those hairs, the acne and the PFB, once you start looking for it in your patients, it's so many people have it, and they're so happy when you
I
treat
know,
it.
I agree. That's what I'm saying, is like these patients get so satisfied. I just wish in California my esthetician could do this, because she would love to do this with facials. I mean, this is the perfect combination with the facial. So my PA, Danielle, does it, and then they get a facial.
You do this first, and then the facial.
Yeah, either or. I mean, I haven't really found that it made a difference. I think it's based on timing. Most of the time, I like the skin to be, clean. So a lot of times I'll have them do, but if they really want to be relaxed after treatment, I have them do the laser first, and then they get the full facial experience. They fall asleep.
Great. Yes, another question. Okay, the question is pre-treatment topicals. Do you use them?
Wait, say pre-treatment what?
Pre-treatment topicals.
Topicals.
Did I get the question right? Yeah. Do you use pre-treatment topicals?
I don't pre-treat for this laser particularly, because I don't think, like I said, that the risk is that high that the laser itself is going to cause a rebound or a flare. But these patients, my patients with dark, they're all on a skincare regimen. My typical regimen, I'm a little crazy and aggressive. My staff will laugh. They know how much I love skincare. Vitamin C, glycolic, and kojic acid in the morning, retinol, hydroquinone at night, and the hydroquinone alternates with something that's a non-hydroquinone every couple days or so. Just to
Great.
give them a little bit so they're not always on the hydroquinone.
Right.
Some sort of exfoliating cleanser, some sort of active cleanser. So maybe something to be able to clean the skin a little bit, maybe something to treat the skin a little bit, whether that's vitamin C, glycolic, a brightener, that type of thing. And then I find really good success. If they have acne, maybe we individually treat the acne with a spot treatment or something. Or if they have like a really bad, deeper, dark spot or area, maybe we're doing something like a Cosmelan 2 or a compounded cream to that area. But Yeah, I'm pretty aggressive, but it's not necessarily a pre-treatment. I'm gonna do one more pass
Right,
here.
I'm right with the, your skin of color patients need skincare regimens.
So yeah, come on close, guys.
And
I'm gonna
there's
show you
so
really
many
quickly
great
on
products
social.
for it.
So if you
Salicylic
guys see on
acid,
social, this device goes on the
retinoids,
skin and can treat dark skin type with really no issues.
in addition to the procedure.
And this is allowing me to help tighten her skin, improve some pigmentation. If she started a little bit of this combination skincare and did about 3 to 6 treatments of this, her skin complexion would be 50 to 70% improved. And she'd have no more of these, what do we say? The sideburns and some of the hormonal acne. She'd be super happy. But if you take a look here, look at the sideburns, you see the flashing lights? That's just because we didn't shave the hairs down or anything, and they're lighting up at the surface because the laser's not going just to the deep layers, it's actually attracting the hair at the surface, which will be fine, she's not gonna get hurt. It just, you feel it a little bit more, right? You feel a little bit over there?
Okay.
You're fine, yeah, she's a strong woman, you could tell. So, all right, perfect. Look up a little bit, I just wanna see your undersurface of your chin. So under here, this is a common area also for women to have some hair and some acne. So a lot of times I kind of test spot here just to see if I see those bright lights, because then I know there's stronger terminal hairs here, and a lot of it may be hormonal and acne, and we want to treat that. So just do a couple passes kind of over in this area, tightens the neck a little bit, but also gets improvement in the overall sort of follicles in this area. As you can see here, there's some hairs right here. They're, you can see them improving. Right there. If you guys look, it turns like a bluish white in the middle.
Nice.
Perfect. I'm gonna do one more pass and then we'll be
terminal
done.
hairs,
I'm gonna
he's
go all
hitting
the way
them.
back.
The whole hormonal hair. Yeah.
She's doing great.